Hello and welcome to Health News Today. I'm Kara Tarleton. Today we are talking about a very important yet controversial topic, mandatory HPV vaccination. The HPV vaccine, also known as the anti-cancer vaccine, has been proven effective in protecting against certain types of HPV and in preventing cervical cancer. HPV and cervical cancer are not new healthcare issues. Both have been around for a long time, but research has now confirmed a strong link between the presence of HPV and the development of cervical cancer. Research has confirmed that HPV is present in all women diagnosed with cervical cancer, and the technology now exists to prevent women from developing this type of cancer. There has been a great deal of controversy related to including the HPV vaccine as a required childhood immunization. Lori Windsor is with Sherry McCaskill, who is here to give us more information about this controversial issue. Sherry is the director of the Health Center and nurse practitioner at Wingate University.
Tell us more about HPV and what it is.
Well, HPV, or the human papillomavirus, is the most common sexually transmitted infection in the United States, and it affects about 6.2 million people each year. And the Centers for Disease Control estimate that 80% of females will be infected with HPV by the age of 50. There are over 100 types of HPV categorized as either low risk or high risk, depending on their association with various types of cancer. And most HPV infections clear on their own, they're asymptomatic, but persistent infection with HPV is the most important risk factor for developing cervical cancer.
How common is cervical cancer?
Well, cervical cancer is the second most common cancer among women in the United States, affecting 500,000 women and ends up with about 300,000 deaths each year.
What is the relationship between HPV and cervical cancer?
Well, what we have found is that HPV is present in 100% of women who develop cervical cancer, and the concerning part of that is only 33% of adolescent females in North Carolina have received any doses of the HPV vaccine, and only 10% have received the required 3 doses.
Interesting. What are some reasons behind the low vaccination rate?
Well, lack of knowledge or understanding on the part of the parents. There's also the concern from parents that vaccination may increase the chances that their child will become sexually active at an earlier age, and research has really found that this is nothing more than a myth. And then the cost of the vaccine has also been an issue, but because of the Affordable Care Act, all new private insurance policies now cover the cost of the vaccine at 100% with no cost sharing or deductibles for the patient.
And what if they do not have health insurance?
Well, that's a good question. For children who don't have health insurance, they're still eligible to receive the vaccine free of charge through the federally financed Vaccines for Children program up to the age of 18.
What is the current recommendation for getting this vaccination?
Well, the Advisory Committee on Immunization Practices and the Centers for Disease Control recommend that all girls and boys at age 11 or 12 get vaccinated before the initiation of sexual activity and before exposure to HPV when the vaccine is most effective.
And what is the benefit for vaccinating males?
Males benefit in a reduction in the number of anal cancers and also many oral cancers, but also in preventing genital warts, which is also caused by the HPV virus. And vaccinating males also helps protect the community by the avoidance of unknowingly passing on the virus to sexual partners.
Why is there so much controversy surrounding mandatory administration of the HPV in adolescents?
Because this anti-cancer vaccine is also used to protect against a sexually transmitted infection, there's been a lot of political, religious, and even parental resistance toward making this mandatory. And many states have already attempted mandatory legislation. Only 2, DC and Virginia, have been successful in making HPV a mandatory requirement for entrance into the 6th grade. And both states do give parents the option to opt out for medical, religious, or even moral reasons.
What are some safety risks that comes along with the HPV vaccine?
Well, there are 2 HPV vaccines that have been determined safe in the United States by the Federal Drug Administration, and The HPV vaccine carries no more risk than any of the other childhood immunizations. The major side effects, or the most common side effects, are soreness or redness at the site of injection. And as with any required immunization, mandatory vaccination really needs to be based on the safety of the vaccine and the vaccine's ability to reduce population-wide morbidity and mortality.
This all sounds like very good information. What can we do to increase the HPV vaccination rate?
Well, I think the most important thing we can do is get information out there to the public. You know, make sure that the public understands what HPV is, how it's transmitted, what we can do to prevent it, and all of the benefits that vaccination has to offer. And I also think, you know, it's important that healthcare providers properly educate their patients and parents on the HPV vaccine, and that will allow parents to make an educated decision about what's best for their child. And also by encouraging local policymakers and lawmakers to advocate for mandatory HPV vaccination.
Sherry, we would like to thank you for being with us today. This is Lori Windsor with Health News Today. Now back to you, Kara.
Cervical cancer is a public health challenge that needs to be defeated. HPV vaccines have the ability to prevent cervical cancer. However, continued resistance toward mandatory vaccination means we are failing to adequately protect our children from this preventable disease. Thanks for joining us on Health News Today.